Good afternoon, everyone, and thank you for joining us again. My name is Lauren.
And my name is Asanta.
And we are trained smoking cessation facilitators and members of the Community Health Improvement Department here at the University of Maryland Medical Center. And this is our third Facebook Live session, so we're about halfway through our sessions that we're going to have for this year. And this session and partnership is with the Baltimore City Health Department. And so for the next 3 months, because this is our third, we like to bring up a couple of topics about smoking cessation and an effort to help you quit in your journey in quitting. And so today what we're going to discuss are the health effects and dangers of using non-traditional tobacco products. And so
So as we go through the sessions, please leave your questions and comments in the comment section below. And if we're not able to answer your questions during the live session, we'll answer them afterwards. Also, please leave your zip code in the comment section so we can know which parts of the city, state, and even country that we're reaching. Please let your families and friends know about our sessions to tune in live with us for next month or today's session. And please also let us know if there's any specific topics that you'd like for us to cover moving forward.
Yeah, so today we've got a lot of information for you, and I think the best thing, so again, we said we're talking about alternatives to smoking, traditional smoking cigarettes, and so there's a lot of products out there that are advertised as positive alternatives, and we're just going to talk about and see, is that really true? Are they really bad for you? Are they really good for you? And I think the best one we should start with is the e-cigarette, because it's the closest to a traditional cigarette.
You're right. You're right, Lauren. So let's first clear up the common question that I always get of whether e-cigarettes or electronic cigarettes are better than traditional cigarettes. So let's start by understanding that e-cigarettes are made to resemble traditional cigarettes. The only difference is that an e-cigarette does not have it doesn't produce smoke. Instead, it produces a water vapor. It's like a type of fog. Okay. And the effect is called vaping. That fog that comes out is called vaping. So the e-cigarette contains a liquid inside of the device that you fill it with, that you smoke, and there's no smoke, no tar, no carbon monoxide.
Okay, so when these companies are advertising that e-cigarettes are healthy, are they just speaking from the standpoint that there is no secondhand smoke? Because what's coming out from the smoker's mouth, which we talked about last session, was
the contents of a cigarette.
Contents of a cigarette was secondhand smoke comes out of the smoker's mouth. That does not contain any harmful effects.
Right, that doesn't contain any harmful effects.
So it's better in the sense that there's no secondhand smoke and you're not hurting anyone else.
Right, but you're still harming yourself. And studies have shown that e-cigarettes contain majority of the same toxins that are in a natural cigarette.
All right, so that's interesting. Let's get into that.
So since we've cleared that up, let's move on to what an actual e-cigarette is. An e-cigarette is a battery-powered device, and you'll see it looks just like a cigarette, but it's silver or different colors or whatever, and it contains a cartridge or a filter, a refillable liquid tank filter. All right, e-cigarettes are powered by batteries, and it has like I said, a refillable tank that contains a liquid mixture. That liquid mixture is called e-liquid or e-juice or
e-juice. Okay, interesting. Keep going.
That e-juice contains a lot of chemicals or a lot of toxins that we talked about in last session.
Interesting.
That are in the regular cigarette.
That are still in the traditional cigarette. Okay.
So today I'm just going to go over a few.
Okay.
So first one is propylene glycol,
which is
fake fog.
So that's the smoke we see coming.
Yes, the vapor. Yep, that's the vapor, hence the word vaping. Next is glycerol.
Okay. And
that is colorless, odorless, and sometimes used as a laxative.
Interesting. And then a lot of people are smoking these e-cigarettes multiple times a day, so taking in a laxative substance multiple times. Well,
you're right. The next one is nicotine, or in this sense, it would be a liquid nicotine, which is highly addictive and toxic and sometimes poisonous.
Okay, so it still contains the nicotine.
It still has the nicotine in there.
All right.
The next one is acetaldehyde.
Okay.
That it can affect the respiratory tract, so it affects your breathing and different things like that.
Okay.
Formaldehyde is the next one, and remember we talked about it last month.
Fluid.
Yes, embalming fluid.
Yes.
It can cause damage to the lungs and digestive system. The next one is toluene. That's used in a paint thinner.
Interesting.
Yeah, and it can cause headaches and nausea. We have cadmium. That's found in batteries.
Battery acid for you.
Yep. If the battery ever explodes, you see that white stuff comes out. Yes. It can cause damage to the liver, kidneys, and brain. Wow. The next one is acetone. I think that was our favorite one the last time.
Only because
we get our nails done.
We get our nails done, but that's not good for you to inhale.
No, of course not. It's found in nail polish, and it can have an effect on the central nervous system.
Okay.
Acrolein. It's an herbicide to control the growth of algae and weeds, and it irritates the skin and nose.
Wow.
Yep. The next one is lead, which is highly toxic, which is we always want to, you do lead checks on houses,
and
you make sure it's not in paint or on your child's toys, because it can cause damage to the brain.
Wow.
Yep. And the last but not least, it's nickel.
Okay.
And that's used in stainless steel, and it can cause cancer and damage to the brain, lungs, and immune system.
So here we are talking about e-cigarettes, one of our first alternatives to traditional smoking, and I have yet to hear anything that actually signifies or shows it to be less harmful than a cigarette.
Yep.
And what it sounds like is that these tobacco companies' only claim to fame is that there's no secondhand smoke and that, you know, you're not hurting anyone else, but you're still hurting yourself. And I feel like that's not necessarily, even to say that you're not hurting anyone else is not a true statement, because even you're hurting yourself.
You're still hurting yourself. You're right.
You've got friends and loved ones who all see you in this process, but that's crazy that it's just as bad.
You're correct, Lauren. That's so right. The claim is that it does not produce smoke, tar, or carbon monoxide and affect anyone else. No third-hand or second-hand smoke, but you're still harming yourself. Okay, and we have to also remember that e-cigarettes can still promote nicotine addiction, especially in children. Especially in children, and it can serve as a gateway to other drugs and other harmful substances.
And our children are actually partaking in e-cigarette smoke, and you know, this is something. Is it something that's targeted to them other than the aspect of it not being a secondhand smoke? Is there something that marketing companies do to reach out to our younger generation?
Yeah, so the e-liquid, or the e-juice, however you want to say it. The liquid nicotine. It comes in a little bottle, usually, and it looks like an eyedropper bottle.
Okay.
It has an easy twist-off cap, and it comes decorated with lots of fun colors.
The cap's not childproof?
It's not childproof, which is why it's not regulated by the federal government.
Wow.
E-juice or e-cigarettes, they're not regulated by the federal government, but we'll get into that more later. But yes, it comes in a little eyedropper bottle that's designed with a lot of colors, and it can resemble liquid candy in a sense.
Yeah.
Okay, it can resemble liquid candy. So in 2012, a study was conducted by the CDC and the AHA, and the results showed that 1.78 million high school and middle school students.
What was that number again?
1.78 million.
Million. Okay.
Had tried e-cigarettes.
Wow.
Yep. And that's between middle and high school.
And that's just crazy that our kids are out there. So really there was a perception that, you know, we were getting down and the numbers of traditional smokers was decreasing, but as these new products are coming out onto the market and becoming more popular, the number of people taking in tobacco and nicotine, they may not be using traditional cigarettes, but they're still receiving these harmful drugs.
You're right. So currently, non-Hispanic whites, current smokers, young adults, and those with higher education, higher income believe that e-cigarettes are less harmful.
Wow, if they're watching today, they won't anymore.
They will not. And the most harmful part about the e-cigarette, Lauren, is that e-juice that we keep mentioning. And you're going to hear it a lot as I talk about e-cigarettes.
Okay.
It's because it's deadly.
Wow.
It's toxic. And it's poisonous. And if a child or toddler or infant is exposed to that little eyedropper bottle of e-juice,
that's not child safe.
That's not childproof. It can be fatal for them.
Wow.
But it also can cause nicotine poisoning for an adult who smokes an e-cigarette.
And so what exactly is nicotine poisoning? Because we know it's the addictive agent in the in the cigarettes, and we know that tobacco is bad for you, but what exactly is nicotine poisoning?
So nicotine poisoning is when you basically get an overdose of nicotine.
Wow.
And it varies from the body type and, your height, your weight, your age to get nicotine poisoning. But a lot of people may not even realize they're poisoned, because nicotine poison resembles regular common flu or cold. Nausea, vomiting, upset stomach, diarrhea, until it gets to the, harsher things such as fainting and loss of consciousness.
Wow, that's crazy.
Yep.
And so I mean, it's just interesting to hear all of this because, like I said, you don't hear this from the tobacco companies or their marketing departments. This is not the type of stuff that they put on the labeling.
You're right. And adults or children smoking e-cigarettes want to be careful because the e-juice can always leak out of the side of the e-cigarette. And then that's a way to get nicotine poisoning as well by directly ingesting it.
So not only is it falsely advertised as being a healthy alternative, the contents of it are still just as bad as a cigarette, and the design of the e-cigarette itself is faulty because it can leak.
Yes, it can leak out of the side of it.
Wow.
So,
I mean, it's just interesting to hear all of this, and again, we're going to go through these alternatives that have been marketed as something that's a positive alternative or a way to help you quit smoking, and it's just interesting to hear all of that about the e-cigarettes.
Yeah.
And the one we're going to go into next
is the fun one. That's the next popular fad going on, especially among young people.
Especially among young people.
Yeah.
And that fad we're talking about is hookah. So smoking hookah, or what is considered a water pipe. And I have to be honest here. I can't tell a lie. I'm a former hookah smoker. And I say that because, not that I was an overly or I smoked it a lot. I didn't. Yeah. I smoked it socially, and I didn't smoke it once a week. I didn't smoke it once a day. But once we get through all of this stuff that I'm about to tell you, you'll understand why even smoking hookah socially is bad for you. And again, not only was I a hookah smoker, we've talked about this, and the fact that we're in the Community Health Improvement Department means I should have known better, but I didn't, which is a lot of reasons that some of us start these products anyway, because we're misinformed. And so my boss, my director, she continuously told me, Lauren, it's not healthy. You don't need to be smoking this. It's not good for you. Trust me. And I listened because, of course, I knew she knew what she was talking about. Yeah. However, it wasn't enough for me to actually see it and take her advice until I heard this one thing, which is that smoking hookah for one session, 1 hour, I'm sorry, not even just a session, but 1 hour alone, is the equivalent or equal to smoking 100 to 200 cigarettes. That's crazy, right?
And I bet that made you quit.
It did. I haven't picked up hookah since.
Well, first, Lauren, let me thank you for admitting that you were a former hookah smoker, and I'm so happy that you said former.
Yes.
Which means you learned something, and it's not good at all.
Yes.
So hopefully everyone else out there, our viewers today, will learn something as well.
Yes, and let me just give you a little bit of background about the hookah pipe, at least in its design. So what it is a pretty large device, and it's got a glass bottom with water in the bottom, and then there's a cylinder that goes up, and there's a tray, and then there's a bowl, and the tray is where you place your tobacco, and then the bowl is where you place the charcoal. The charcoal, which is used to burn the tobacco. So once you light the charcoal and it starts to burn the tobacco, the smoke travels down the cylinder underneath the water and then comes back out the pipe, which or the hose, which is where you're going to inhale the smoke. And some hookah pipes have one hose, and some hookah pipes have multiple hoses, which is why it's something that a lot of our children are doing, or you may have heard of something called a hookah lounge. And so let's just talk about the charcoal for a second. Charcoal is used, again, to heat the tobacco, and it actually raises your health risks, not only because of the tobacco and nicotine, which we'll get into, but it produces high levels of carbon monoxide. Okay, so we all know, and maybe we don't all know, but carbon monoxide is not good for you. It is poisonous, and that's why we buy carbon monoxide detectors for our home because again, it's an odorless gas.
Odorless,
Yep. And so we buy the detectors for our house to prevent ourselves and our children from inhaling that, as well as if it's a cold day outside and you have to heat up your car, you have a garage. To lift your garage door before you turn your car, so that way when you finally come out to get in, your garage is not filled with carbon monoxide poisoning.
Right.
And yet here we are inhaling it into our lungs, and there's so many other things that we do to protect ourselves against carbon monoxide.
Wow.
Yeah.
That's like we do so much to prevent it.
Yes.
But then we come to a hookah lounge and we sit down and we welcome it.
Yes, absolutely.
Wow, that's weird.
Yeah. So there's even, if you think about it, even when you're grilling outside, you're grilling outside.
Yeah.
And so you make sure that you're preventing or making sure that you have plenty of fresh air coming in, so that way you can offset the carbon monoxide.
Yeah, carbon monoxide poisoning is real, and we must take, notice of it.
Yeah, absolutely. Yeah. And so another health risk here is that the increased risk of oral cancers. So we've talked about, of course, lung cancer, throat cancer, all these other different types of cancers that can be caused by just taking in smoke and tobacco products. But the oral cancers are even more so of an issue when it comes to hookah smoking. And we'll get into those a little bit later as well when we venture into another type of alternative, which we have not gotten to yet.
Okay.
But since, again, hookah is a water pipe, there's something about the hookah pipe of how it's used that hookah smokers, make sure you pay attention to this one, hookah smokers absorb or take in more of the harmful chemicals and toxins that are found in cigarettes than cigarette smokers do.
So wait a minute. A person smoking hookah takes in more toxins and chemicals and poisoning than a regular person just smoking a cigarette.
That's correct. So the reason that is because one hookah session will say you'll take about 200 puffs.
Okay.
One cigarette is about 20 puffs. And then one session and I say session because usually when you smoke hookah, you sit down and you smoke it until the charcoal is burned away or all of the tobacco has been used. And so one session with smoking hookah has 90,000 milliliters of smoke being inhaled. 90,000 milliliters.
Wow.
And that's in comparison to one cigarette, which is roughly about 500 to 600 milliliters.
Okay. Wow, Lauren, you just blew my mind.
Yeah, it's a lot.
So wait, let's break that down for our viewers today and put that into something let's put that 90,000 milliliters into something that we use every day, like, I don't know.
How about a 20-ounce water bottle?
Okay, we use that every day.
Okay, we should use that every day.
Yes,
Water's really good for you. Get your 8 glasses. So let's say 90,000 milliliters is equal to 152 20-ounce bottles of water. So in one night, you're inhaling that much smoke.
Wow, we couldn't even fit 152 bottles of water on our desk today.
It would be really bad, and that's just the visual we want you to have. Wow. But we don't tell you this to promote cigarettes and say, hey, cigarettes are better than hookah. Absolutely not. Cigarettes they're just extremely bad for you. They cause several diseases, cancers, other things that are just harmful to your body. However, so does hookah. And that's what we're talking about today, is these alternatives that people think, it's not that bad. It's not as bad for me as cigarettes. And we want you to see they're really just as bad, and depending on how frequent you use these products can make it worse than an actual cigarette.
Lauren, I think that from my perspective, younger people or even older adults, because you said the hookah lounges and the hookah bars, I know from just hearing from friends and things that it's very sociable.
Yes.
And it's actually, I feel like more people go there to hang out with friends more so than they go there to actually smoke the hookah.
That's true, and that's still harmful to that person who's not smoking, because if you think about it, again, we're in a room, the smoke that's going around. So again, we mentioned that hookah has secondhand smoke, but it has secondhand carbon monoxide and all the other toxins that are going in there. So if you're going with a friend and you're like, no, I don't want any, you're going to get some regardless of whether you want to inhale it by your own decision or not, because you're sitting there with all the secondhand smoke. So we've talked about, of course, the oral cancers, and when we get done with all of them, we're going to talk about a lot of the common diseases and conditions that you can get from all of these substances. Okay. But a couple that are specific to hookah that a lot of people don't think about. One is your physical safety. Let's talk about the fact that there's no smoke detector in the building.
I was just about to ask you that question.
There's no carbon monoxide detector in the building, because if so, they wouldn't be able to...
They wouldn't be able to smoke. The detectors would be going off every second.
The lounge would be pointless, because they have to make sure that the smoke can flow freely through the building without constant shutdown and everything like that. So now you've got the possibility. And I know you may say, oh, well, what's the likelihood of that happening? But, you know, it can happen. There could be a fire that you may mistake the flame.
Charcoal for burning, yeah.
Yeah, charcoal for burning. You may mistake the smoke coming from that for not cigarette smoke, the hookah smoke. I apologize for the laughing, but as we're talking about this, our videographer is hearing all of this information, some of it for the first time. And so her response is the response that we hope you're having, and that it's a realization that, wow, this stuff really is bad. Yeah. And so, again, even if you're not trying to smoke hookah, if you go to a hookah lounge, you're smoking hookah.
Yeah.
So that's the physical danger, and all of these conditions and diseases, again, are physical danger. But this is the going and being in a place where the fire can be started is something you can easily prevent.
Yes, of course.
Another thing that hookah does is, ladies, it decreases your ability to have kids, your chances of being able to have, your fertility. Yeah. So that's something you should really think about, especially if you're in those childbearing years, you really want a big family, or even if you don't know yet, but you're, one day later, have to think about all the things that we're doing and we're putting into our body and how they affect it. And so that's another thing. And then we have all these other diseases that aren't cancer and they aren't heart disease, though they all are possibilities. But there's things like TB, tuberculosis,
okay,
which is about a year of treatment and you just feel terrible throughout that entire year.
Yes.
There's bronchitis, which is about 6 weeks for recovery. You can't go around people for a couple of weeks of that either, which is not painful, continuous coughing.
And that can always advance into asthma and COPD and other lung... Oh, gosh.
Yes, absolutely. There's also... Are you ready for this one?
Which one?
Herpes.
Oh, I was going to ask you about herpes because, yes, STDs are associated with sharing the hookah pipe, right?
Exactly.
Oh, wow.
And I know what you're going to say because, again, I've been there. I know what I'm talking about. The little plastic mouthpieces that they give you. Yes, they do give you those. So that way you can have a false sense of being, clean and protecting yourself from others. However, again, that is a false sense because even though you take off the plastic mouthpiece, your saliva, your friend's saliva, anyone else who may have used that specific pipe before is still housed inside the tube portion of that. And not only that, some people may not, by the end of the night, you may stop caring about, I don't feel like it, or, and then you may have other people who actually at the beginning of the night don't care for switching back and forth. And so you just have to keep that in mind.
A lot of us trust our friends to be, health conscious just as much as us, or healthy in a sense. And you might just say, it's okay, that's my best friend. Okay, that's my girlfriend. Okay, it doesn't matter.
And it's absolutely, and you never know. And it's not necessarily a harmful or to say anything bad about that specific person.
Yeah.
But you always have to be mindful of your own personal health. Also, hepatitis is an issue.
Okay. Oh.
The flu. Something as simple, I won't say simple because it's not fun, but you can get the flu from, again, sharing the mouthpiece and the pipe of the hookah device. So all of this about the activity I used to love to do that I do no more. So that's,
Well, I'm glad you do it no more. And once again, thank you for sharing. And I hope that someone decides to quit.
Yeah.
If they're doing it, we will talk about other alternatives to what you can do in place of going out to hookah bar with friends in a few seconds.
And just one more thing, again, it's not about how frequently you smoke the hookah. It could be socially, but because of the way it's used, you could really inhale way more toxins than you intend to. So,
So, let's move into our next topic. I think we chose this one because of where we live.
That's true.
Here in Baltimore City, and when we're out in the community, we always hear a common answer or common reaction to our smoking cessation tables or anything like that.
I don't smoke cigarettes. I just smoke Black and Milds.
Oh yes, or I smoke cigars or something like that, and we're just like, let's clear up that today.
Let's clear up that. Yes.
So we always hear people say in Baltimore City that they smoke Black and Milds, but Black and Milds is a form of a cigar.
Yes.
And it's actually 2 to 3 times worse than an actual cigarette.
Really?
It is.
Okay.
So, why is it worse? It's because an actual cigar or Black and Mild is tobacco paper rolled in tobacco leaves.
Okay. So you mean to tell me there's a double dose of tobacco. The leaves that you're actually smoking and then the roll that it's actually wrapped in it contains tobacco as well.
You are right.
Wow.
You are so right. A cigar or black and mild contains just as much toxic and cancer-causing agents found in a cigarette. There's no difference. You're getting a double dosage with a black and mild or a cigar.
Because it's got the contained in the wrapping.
Yep.
Wow.
It's tobacco wrapped in tobacco. That's how you have to describe it. It's tobacco wrapped in tobacco.
Okay, so.
But not also that. I've heard a couple people when I teach smoking classes or something like that to help them quit. A lot of people teach me things, and I always love to learn. And a lot of guys or women tell me that people will empty the tobacco in a cigar or black and mild.
Okay.
And they will add marijuana to it.
Wow.
Yes.
That's interesting.
So they add marijuana to it and smoke it like that, which means not only are you now getting a dose of cigarette or tobacco smoke or tobacco chemicals, you're getting the marijuana chemicals as well.
Yeah. So we are focused on tobacco reduction and harm reduction. However, we're the Community Health Improvement Department, and we want to make sure you're healthy in all manners of life, and that includes the use of marijuana. And again, since we are talking about smoking and quitting smoking, any form of smoke into your lungs is bad for you. There's no smoke that you can put in your lungs that's going to be a benefit to your health.
Yeah.
So the double dose of harmful substances is what you're saying is a common
it's
practice.
A common thing apparently. It's very common. However, we will talk about marijuana next one.
Yes.
We'll get into that and touch and answer a couple questions that we've heard about that.
Yeah.
And clear things up. So
interesting.
Fun. Black and milds are not better than traditional cigarettes.
They're not better.
They're even worse.
So far we've talked about 3 different types of alternatives.
Yes.
The e-cigarettes, the hookah smoking, and now cigars and black and milds. And black and milds are just a type of cigar. And also, we forgot to mention, hookah is flavored.
Yes.
Black and milds are flavored. Again, more targeting towards our youth and making it easier for even us as adults to, reach out and try these things, because the flavoring sometimes covers up the harsh flavor of the actual product that's in there.
You're right.
And so that's 3.
Okay.
Are any of them beneficial to our health?
No.
Okay,
Not
so
one.
let's move on to the next one, smokeless tobacco. So far we haven't found anything that's positive for us, but maybe smokeless tobacco will have something, maybe not. So smokeless tobacco can actually lead to the nicotine addiction that we've talked about.
Yes. That's
and
not good.
It also causes cancer of the throat, the mouth, and actually the pancreas. And I know before, Asante, you've talked about how smoking and tobacco use itself can harm majority of all of the body's organs.
Yes.
So it's interesting to see that the pancreas is now here as a type of cancer that can be acquired through smokeless tobacco use. And so there are several different types of smokeless tobacco, and so we're just going to go through those because honestly I didn't even know there were this many different types. I knew chewing tobacco. So let's just get started with that one. There's chewing tobacco, which is oral or spit tobacco, and you can either chew it or place it between your lip and your gum. And so the saliva and excess juices that are produced, again, that's why it's called spit tobacco, is spit out. And that color is usually brown. And I know, unfortunately, a lot of times we see this in some professional athletes, and as their choice of, I guess, to help them concentrate while they're out on the field. But whatever it may be, it's not healthy for you. Then we move on to snuff or dipping, and there are 2 different types of this one. There's the moist version, which again is placed in between the lip and the gum, and again, this one is still placed in between the lip and the gum, but this one is smoke-free, of course, and spit-free. So there's no excess saliva being produced with this one. And then the second type of snuff is dry, and this is used to sniff or inhale through your nose, which opens up a completely different type of health risk, and eventually can harm your nasal passages and everything else. So the next one is snus. It's actually spelled S-N-U-S, but it's pronounced snus. This one, again, is placed in between the gum and the lip. However, instead of spitting out the excess juice and liquid, this one is generally flavored, and so that way you swallow all the excess juice. So there's no excess chemicals being spit out to cut down on any of the absorption. And again, all of this, all the tobacco and the toxins and the chemicals are being absorbed into your mouth, which puts you at greater risk for all of these oral diseases and conditions. And the next one is dissolvable tobacco, and that again is flavored, and it comes in tablets, comes in film strips, lozenges, and little pellets. And again, like I said, flavored, sometimes there's sugar added, and it's just, again, how these tobacco companies are marketing to our children, because they literally look like candy. I've seen some of them. If you want to take a look online and Google just dissolvable tobacco and film strip, like literally the little strips of breath that you use, the breath strips, look just like it. And so a lot of this, and before we had mentioned that the relaxed regulation from the FDA on these alternative tobacco products. So with cigarettes, there is an FDA regulation that cigarette companies are not allowed to flavor their cigarettes. However, that regulation does not cross over to the hookah, the e-cigarettes, the cigars, the black and milds, all of the chewing tobacco, smokeless tobacco that we have here. So all of these are free game for all of these tobacco companies to go out there.
You're right.
And advertise to you, our children, or like you mentioned before, middle school students.
Yeah, you're right. The FDA has not regulated e-cigarettes or different things like that because of the labeling. It's incomplete and misleading.
Yeah.
And that's why it's not regulated. So, but it's allowed to be sold in stores, although it's not regulated. The user is supposed to use it at their own will.
Wow. And so just to follow up, just so there's no confusion, before I got into smokeless tobacco, I said maybe we'd find something that was beneficial. There wasn't.
There was nothing.
There's nothing that's beneficial with smoking tobacco. And to essentially answer your question and answer our original question, are these alternatives really that bad? Yes, they are. They are really that bad. They have the same tobacco content, they have the same nicotine content, the same chemicals that are used in cigarettes that are just bad for your health.
Wow.
And not only that, they're harmful. Not only are they harmful to you just like cigarettes, but they're secretly targeted towards our children, opening up a whole new generation to nicotine and tobacco addiction. So, if you really want to quit smoking and try an alternative to smoking, talk to your doctor, your primary care physician, about nicotine replacement therapies that are actually designed to help you quit smoking. All of the things we went through today are not designed to help you quit smoking. They're just different tobacco products that you can smoke or use to receive the tobacco and nicotine. But they're not meant to help you.
Yes, they're not for quitting smoking.
Exactly. And there's other things that you can do on your own that don't require going to a doctor's office that can help you in the time when you're feeling weak, you feel like you need to go to a lounge with your friends, or you want to buy that next e-cigarette or the e-juice as you mentioned. So you can, one, spend time at places that don't allow smoking or smoking alternatives. You can spend time with friends who don't smoke. I'm now a reformed person who does not smoke, and so if you are a smoker, find someone who will say, hey, that's not good for you, almost to the point of, being a little obnoxious, because they'll make sure that if they're with you, they'll make sure that you're not smoking.
You're not.
And then also take maybe a fun class. There's cooking classes you can take. There's all those paint nights. There's also pottery classes you can do.
You can even take a smoking cessation class.
You could take a smoking cessation class. Look at that class. It's a great idea, son. So thank you for that. And then also, if you want to be productive outside of taking a smoking cessation class, you can do some spring cleaning. Get your hands busy, Go through your house, declutter yourself. That's another thing. If you declutter some things that are around you, you'll feel a little more free to be healthier, to do better, and things like that. And then take maybe the kids, family members, the dog, take them to a park. Go outside, get some fresh air, and just give your body a different option than the smoke that has been going into it or the toxins that have been going into it. And of course, always, always, always contact your quit buddy and let them know that, hey, I'm trying to do better, and I just found out today with the University of Maryland Smoking Cessation Facilitators that all of these alternatives are bad and I need to find something else to do. Can you join me? Let's go to a pottery class. Let's go to a smoking cessation class. all these other things. So just
those are really good ideas, Lauren. Thank you for sharing that. Before we get out of here for today, we just want to leave you with a couple of facts and talk to you about a couple of things that come out of when you use these alternatives. Yeah. So according to the Center for Disease Control, when you cut down on the use of traditional cigarettes and replace it with another tobacco product, you may think you're becoming more healthy, like we expressed today and shared that a lot of people think e-cigarettes are better because it reduces secondhand smoke or thirdhand smoke. However, this is not always true. Yeah. And it's actually has a name for it. It's called a dual use or double use. Wow. And it's not an effective way to safeguard your health, whether you're using an e-cigarette or smokeless tobacco or any type of thing in addition to a regular cigarette or to replace it. Quitting smoking of all substances. All substances, guys. All substances. It's completely it's the only important way to quit smoking and becoming smoke-free. Yes. So I think that's our take-home message for today. And we want to thank you for joining us for our third session. Our third session. And hopefully we talked about some topics that'll definitely you'll put it in front of your mind and say, hey, the next time I won't do that. Absolutely. And then please share this video because, like I said, there are some things that we learned while preparing for this video. There's things that we learned just for being in this department that we didn't know before. And it's very important for people to get this information out there because the tobacco companies are not giving it to you. So we thank you. We hope you're continuing on in your journey to quit. And we will see you next month on Monday, April 24th at noon. Yep. And we will be talking about smoking addiction, why people smoke, and smoking myths. All right. Take care. Thank you.